My name is Casey Dyson. I'm a registered nurse and I also work in labor and delivery. I own the Mama Coach and I'm offering prenatal education, postnatal education, sleep consultation, and just basic mom support out in the community. The coronavirus or COVID-19 it's really affected the entire community, but it's also affected pregnancy and breastfeeding, and women are they're scared and things are changing. All of their courses are being canceled out in the community, and so they're missing out on education. During delivery, the guests in the room are being limited, and so they're only allowed one guest per delivery, and their moms and dads and grandpas, whoever it is that they want to attend the delivery, they're not getting to do that. I know some hospitals and places are allowing FaceTime, which is kind of interesting. It's kind of fun and different, but also diapers are decreasing, wipes are hard to find, and formula, and that's huge because the babies that need that formula, they're not going to be able to get fed appropriately. A common question I'm getting right now is whether or not moms should continue to breastfeed with this virus, and the answer is yes. Definitely yes. We know that breast milk is full of antibodies to protect baby, and it increases their immune system. And we also know that when mom is sick or getting sick, her body naturally makes antibodies to feed that baby. The big deal with that is that we want them to change their clothes and then wash their hands for 20 or 30 seconds in warm, hot, soapy water, and then put the baby to the breast. If you have a mask, then we're encouraging them to cover their face during the feed to decrease the likelihood of those droplets from talking, coughing, sneezing getting on the baby, because that's how this virus is being transferred so far. Also, another method, if you're not comfortable with actually putting baby to the breast, is you can pump. And we are just, again, change your clothes, wash your hands very vigorously, and then make sure your pump pieces are sterilized and clean. A lot of pregnant women are wondering if they're at an increased risk for getting this virus, COVID-19. And so far, the studies are showing that they are not at an increased risk. It's not being transferred in utero through the placenta, amniotic fluid, or at birth. It's a droplet transmission. And so if the baby is exposed after birth, then that's when they're seeing issues. It's also so far not causing preterm labor. I think there's been one case where there's been a preterm delivery, and that's been for the choice that's been what's best for the mom and baby, decided by the doctor and the mother. And so right now, pregnancy is not at an increased risk. However, historically, we do know that pregnant women have contracted this other viruses similar and been more susceptible. So automatically, we're placing them into the risk category and just advising them to take extra precautions. My personal Instagram and Facebook is the Mama Coach Casey. And I'm constantly posting education, tips, freebies on those sites. And then I'm also trying to keep up to date with the CDC, ACOG, and WHO is in regards to COVID-19. And I'll be posting every so often as the information's changing, because this is more and more information is coming out daily on that information. So follow me and get some updates.